presenter is Commissaris, and she will be presenting home-based care, an imperfect answer to the critical healthcare professional shortage in Zambia.
Alright, just to start out, the way I got interested in this topic is through a volunteer program I completed this summer that was sponsored by the P Global Fund. I did a 4-week public health volunteer internship through the African Impact Program, which houses volunteers from all over the world in Livingstone, Zambia, which is sponsored by the Happy Africa Foundation. The work I did in this program was separated into 2 categories: community service work and education-based work, and then also public health and medical type work. The community service projects I participated in included family support, which is pictured below. Family support was basically our way of meeting with local children, most of whom had sick parents infected with AIDS or TB, and we just read with them and played with them and gave them some of the attention they otherwise wouldn't have received because of the issues with their families. We also participated in Reading Club, which was just an after-school program to help students try and learn English and just read with them, and then an adult literacy program where we taught local adults from the community who didn't have any English-speaking skills. We just taught them basic conversational English in order to help them with any upward mobility. And then the health-related projects I did included working in clinics, which included basic patient intake skills like taking blood pressure and temperature, other vital signs like that, inquiring people about their symptoms and their general problems. We did patient registration and any other tests that needed to be completed at the clinic, like working at the pharmacy or helping out in the lab with malaria, TB, and HIV tests. We accompanied community volunteers on home-based care projects, which is going to be the focus of my talk. And then one of the main things I worked on that was my project through African Impact is, for the last couple of weeks I was there, I did an afternoon course for community volunteers who were trying to start their own home-based care program in the township of Nigeria. Before I continue, just to define home-based care is the provision of basic nursing care needs by formal or informal caregivers to people in their own homes. People qualifying for this care are those who have had strokes, are living with HIV, AIDS, who are physically or mentally challenged, frail older persons, or those who are terminally ill. And the work we did in Livingston was mostly focused on people living with HIV and AIDS, people with severe disabilities, and HIV and AIDS with TB co-infections. And one thing to note in particular about the program I worked with and the type of home-based care I'm discussing in this presentation is that it's entirely run by community volunteers who are not health professionals. They've received no formal training in any of these things, and so it's really a good way to bring about ownership of the problem with these people who just have some spare time and they want to use it to help their community. The home-based care course that I taught while I was in Zambia was a 12-week course. I only was able to teach the first couple weeks because I wasn't there for the whole summer. And it was for volunteer community members. And the goal of starting the community-run home-based care program was in order to increase the healthcare options for people living in this community, because unlike the other communities we worked in surrounding the city of Livingston, the township of Ngwenya was somewhat more far removed from the actual city, and they didn't have their own health center like a lot of the other communities. So people in this town really had to either try and diagnose at home, go to traditional medicine practitioners, or wait until problems got much worse and then finally make the trip in to see a clinic, which at usually that point it was too late to really do anything effective. A couple of the topics covered by the course I taught included very basic HIV and AIDS epidemiology, just the basic information so that people could understand what was occurring in their community, what was the global sense of the issue as well as the local sense. We taught first aid and infection control. These kind of go hand in hand, because when people had things like cuts or any other sort of health issue involving bodily fluids, it was really important to us that we teach them how to treat these while still protecting themselves, because as you know, HIV is transmitted through blood as well as other bodily fluids. And so we taught first aid with a focus on infection control for both tuberculosis and HIV. And we also taught basic organizational skills, the things important to run a basic healthcare program, how to keep in contact with patients, how to communicate effectively with local clinics and the area hospital. And pictured below are just a couple pictures of me on my trip. The first picture is me with my home-based care class on the last day of class. Pictured next to me is the class leader, and she was the one, it was almost a full-time job for her, even though none of these people were paid. She made sure everything was run smoothly in their program and kept track of all the patient records and things like that. Next is just a small group of home-based care givers from Maramba, which is one of the clinics that have the most established program. And then lastly is just a picture of the Maramba Clinic, which is the clinic that was most extensive outside of the actual city of Livingstone Hospital. Just some background information about the country of Zambia, which is where I did my work. It's a landlocked country in sub-Saharan Africa with a population of about 12 million and a life expectancy of just under 40 years. The median age is 17 years and the infant mortality is 102 deaths per 1,000 live births. The gross domestic product per capita is $1,500 and approximately 86% of the country is living below the poverty level. So as you can see, it very much fits the description of a developing country. The one positive thing about Zambia is, although it's a very poor and developing country, it's also a very safe country. There's been hardly any issues with violence or military action, and so it's very attractive to NGOs and health and government organizations to come in and try and improve the situation because it is a very safe place.